Welcome to the wonderful world of wellness with Dr. Andy Mencia. This medical program heard from 7 to 7:30 each Saturday right here on WSBR 740 AM is brought to you by the Adult and Geriatric Center under the medical direction of geriatrician Dr. Andy Mencia. Oh, good morning.
Good morning.
Dr.
Good morning.
Good morning. How are we doing?
Right, well, we're doing some different things, right? And I'm getting you on Facebook Live,
on Facebook Live, yeah, we advertise it. We have to keep our promise.
Yeah, that's
we
right.
are not politicians.
Yeah,
we
no,
keep
no,
our
no.
promises.
We say we do it.
Okay,
Politicians,
so I
they promise and then they remind you that they didn't promise what they promised.
Yeah, well, but you always promise.
We
what
always
you
promise, and sometimes our body promises things that don't happen. So constipation is the topic.
Constipation.
Constipation.
That's an
we
interesting
got
word.
constipation. We got
Going on.
You know, a lot of people see constipation as a naive thing, as a very naive thing. And people, when they go to the doctor, it's not the thing they want to talk about. Usually you won't go to the doctor for constipation unless it is really severe.
Because you go to the pharmacy, right? And you get all that.
Sometimes you might go to a
crappy
friend,
stuff, right?
which is even worse. You go to a friend and say, what do you use to move your bowel? Some people just ask the friend. And when they come to us, they say, well, my friend or my wife or my daughter or my father used this, so I'm using that. So people usually see what other household members are using for constipation, and they want to use the same thing. Or some of them are smarter, and they go even to the pharmacist and ask the pharmacist, what do you think will be good for me? What we need to take in consideration, if you take no medication, constipation is still a problem. But if you take other medications, when you take over-the-counter remedies, they can interfere with those medications and vitamins and nutrients that you take. So it is important that if you have constipation, that you talk to your doctor. Speak to a healthcare provider, a professional that can address this situation. The reason I want to talk about the topic, because I had a young man that did his bypass surgery, and he lost over 150 pounds, and he's doing great. And he came for a routine visit because he has a significant B12 deficiency, so we get B12 injections. And so every month he's by my office. He's, very diligent about his health. A young guy in his 30s. And he said, doctor, it's kind of funny, but when I urinate, when he passes urine, he said, I have bubbles. So we laugh about it. I said, maybe you're drinking beer. And that will make the urine produce a lot of bubbles. He said, no, I don't drink beer. And I'm telling you, I'm having bubbles. So I said, let's check your urine. So we checked the urine. The urine was normal. So the next day I said, well, since the urine, we are not even thinking about the colon. And I'm not switching topic here. Since it's the urine, let me send you to a urologist. And the urologist put a scope in there to look into the bladder, and when you look at the dome of the bladder, you see there's an extra hole. So then he got a CAT scan with contrast, and that extra hole happened to be a fistula. A fistula is a connection between two organs, all to the outside. So what was happening, because he was suffering from constipation, we never spoke about that, because he was suffering from constipation, the constipation produced something called diverticulosis. When they become inflamed, they become diverticulitis. Now, if we look here, since we're doing Facebook Live, this is the large intestine only. So we took the body, that's the outside of the body, that's my painting. This is your large intestine. So when you eat food, it goes through the small intestine, and then it comes from the small intestine into the large intestine, and then it goes all around, and then the waste material is the feces. So what happens when a person has constipation means that the feces is not coming out. It gets stuck in here. And that feces getting stuck in the large intestine, it takes the intestine like you would take a balloon and pushes little pouches that comes out. And those little pouches that we see, when you look from inside, they look like tiny little holes. But when you look from the side, when you open the body and look from the side, they are little appendicular like that. So they look exactly like the appendix. They look exactly like the appendix, but they are on the left side. And they get inflamed like the appendix, but not on the right, on the left. So the symptom we say to the student, to the medical student, the diverticulitis is like appendicitis, but on the left. So this young guy had this diverticulum that was growing bigger, and it made contact with the bladder. And, when you have stool in your body, the stool can, usually the bacteria that we have in the large intestine will produce gases, right? And that's why we pass gases through the back, not through the front. So those gases those gases were coming into his bladder. So when he was urinating, he was passing gases through the urine. So another case that happened many years ago was I had a patient that came to the hospital, and he said, by the way, since I'm in the hospital, I have this wound on the front of my thigh that never heals. And they had tried all kind of remedy, all kind of antibiotic. They gave me intravenous antibiotic. Everything that they give me will make it better. But, and it keep oozing all the time. So feces were coming through here. So, of course, we did another CAT scan with contrast on that occasion. And the diverticulum grew all the way into the front of his thigh. Look how how long they can extend. And worst case scenario is one of those diverticulum, they can burst in your intestine. And those are the people that are forced to end up with a bag. Now, that young guy that we spoke about from this past week, what we're going to do on him, or he's scheduled to have done, because when they scoping now, the GI doctor or the surgeon, the colorectal surgeon scoping, and notice that he has so many diverticulum in there that his best remedy will be to cut here and cut there, and then do what we call an end-to-end anastomosis, so he doesn't have to end up with a bag. So he's very lucky. And
that's great. It's the first time you do a lot of drawing. People don't know that. It's the first time now we're able to show what you drew.
Right, because a lot of time we are speaking, so we thank Facebook for this addition of...
And Jamie Titcom is watching right now.
Yeah. So there's a lot of, people know about hemorrhoids. Well, everybody know about hemorrhoids. Why am I getting hemorrhoids? A lot of time is you suffering from constipation, and you want to live with it, and you don't have to live with constipation. It's not good for your body. Imagine when the large intestine is there for transit, for things to move through, and for you to have 2, 3, 4, 5 meals a day, and all of that stuff. You want to be able to, the waste material, to get rid of that in the toilet. So if you're not getting rid of that, it's going to back up. And if you remember Bill one day having his, may his soul rest in peace, having the...
No, he's not resting in peace. He's having fun out there.
He's having fun out there.
No, his soul's having fun. Okay.
So, some people with constipation will complain of shortness of breath because the large intestine is a reservoir. So even though we draw large intestine like this, it can grow to 4 times its size. 4 times. So imagine this big thing growing 4 times its size. There's no room for the small intestine. It will push up into the stomach, taking away your appetite. It will push up into the lungs, and it will push up even into the heart. So constipation can affect all those internal organs, from the shoulder down to your hip. So it will affect the bladder, the uterus. All of these organs will be affected when the large intestine just keep enlarging. There's something called mega for big colon, megacolon. When a person has a megacolon, it's a large intestine that had grown, but when you empty all the stool, it doesn't come back together. It lost the elasticity the large intestine had before. So when it comes to constipation, it's not that you have to have a bowel movement every day.
I was going to ask you about that.
It doesn't mean that you have, but when you see that, let's say you have a bowel movement every third day.
Really?
Well, there are patients, I'm a speaker on constipation for other physicians. I'm a national speaker for some of the products that help with constipation. And there are people in the study, they have people that go every 11th day.
Oh, no, come on, Dr. Mencia.
Every 12th day.
Dr.
So,
Mencia.
and they had been like this all their life. So, and they live with this, so they feel this is normal. So they say, well, if I go once a week, if I went this week, I'm okay. And you're just getting rid of some of the excess. You are not really having a complete bowel movement. And that's one of the parameters we use when we're studying any drug for constipation. We ask the patient, how frequent do you go? And do you feel that you had a complete bowel movement? A complete bowel movement, you feel completely empty, that there is nothing else left in there, and half an hour later you don't have to go back because you felt, there's still more stool in there. So when you have a complete bowel movement, whatever you do to help you reach there, then you have control your constipation, or your bowel movements are normal. Every time, if you go every morning and your bowel movements are normal, you don't have to force yourself, then you have a good, you don't have any problem with constipation. But when you see that you go every third day and suddenly it changes to every fifth day, that's a sign of constipation. If you go every day or twice a day and suddenly you go every other day or every third day, that's a significant sign of constipation. So when your frequency decreases, it is telling you that you are suffering from constipation. And then you don't have to go through all the complication of constipation, which, the common one is the hemorrhoids. And some people, when they wipe themselves, they don't feel any hemorrhoids, so they say they don't know they have it. Only when they get a colonoscopy or they go to a proctologist and they take a look inside, and then we see with the scope that there are internal hemorrhoids, and that's a sign that the person had constipation.
Okay, can I lighten this up with some food? So
yeah,
help
let's
us.
look about some food.
Let's talk about what people should do, a natural way to help constipation.
Right. And that's the best way. Before you start taking medication, is you have to come and see one of my dietitians. They will sit down with you. The first thing they're going to do is they want to know what you are eating. They're going to look at your regimen. And again, just like if you didn't talk to me about constipation, I will never be able to help you. So if you won't be honest to the dietitian when you come and see them, and tell them what you actually are eating. You eat a lot of starches, and you don't eat fibers. So you are more prone to push yourself toward constipation than to help yourself. So the things rich in fibers, the vegetable and fruits that are rich in fiber, and that's what they're going to spend time with you. Because when you do it on your own, if you go to your friend and say, what helps you with the constipation? Say, I eat prunes. I'm going to go and eat prunes. Then you go to your primary care doctor, or you go to the diabetologist, and they say, why is your sugar going up? Yeah, no, my diet is the same. I didn't change my diet.
The prunes,
well, you did.
Right?
You just add a prune. Your diet is everything that you put in your mouth. That is food, that is. No, anything that you put in your mouth, that is food. That's considered part of your diet. So if you're going to swallow it, we want to know what it is. So if you eat a low-fiber diet, you're going to be more prone to constipation. So, eating sprouts, we were talking about,
Brussels sprouts, and
cabbage, broccoli.
How about fruit?
In fruits, the mango, they are very rich in
Not
in
fruit
fiber.
Juices, though. You should eat the fruit, right?
The fruit themselves.
And apples are good, aren't they?
An apple a day will keep you close to my office.
Yeah. Well, let me ask you, talk about apples. Someone said that eating granny apples is better. Why would that be? Not as much sugar?
I think it's the sugar, right? So more, okay. I think Charlie want to get into...
No, that's right. He's hearing us.
Charlie,
He thinks something's happening.
They're talking about my constipation.
Right, that's
right. Why don't we take a snapshot of Charlie? So,
okay, we're going to take a shot of you, Charlie.
It's Charlie. There is Charlie, everybody.
Hello, Charlie. That was cute.
Charlie's into the topic.
Right.
Anita and I, we come here. And we bring Charlie because we need an audience, so he's here.
Well, wait, Ina. Wait, I'm moving over to Ina. Hello, Ina. Ina's our great audience, right?
Beautiful Ina.
Stand up like everybody.
Stand up, Ina.
Beautiful Ina.
Well, I just want to tell, before we have Ina standing up, let's talk about Stonewater Med Spa. You might as well, Ina. You got to move this up so you can speak about it.
Yeah.
Now, there are people who come in for constipation, but Dr. Mencia did tell us that there's a massage that will help, and we're going to get him back in a minute. But Med Spa, Stonewater Med Spa, please go there for your massage, 954-561-8799.
And remember, it's a Valentine.
Right.
It's a month of love and all of that.
Love and beautification.
Exactly. So we have a lot of specials going on in the spa.
You
for all
gotta
the
love
services,
yourself.
So you're going to love it.
Well, the other thing is I don't want to forget to talk about today. Let's just interrupt yourself and let's talk about what AGI Medical and Dental Centers. Who's on your staff today?
Today we're going to have Dr. Spavek. Dr. Spavek is the orthopedic physician. He's an MD, he's an orthopedic, and he has he done a fellowship training in spine. So he's going to be there. We're going to have Dr. Pimentel. He's been on our show several times. And Dr. Pimentel is a neurologist. So anything that have to deal with the brain and the nervous system, Parkinson's disease, Alzheimer's, dementia, migraine, all of those neurological conditions are seen by him. Person with dizziness, lightheadedness. Sometimes we don't think of the neurologist. We think of the ear, nose, and throat. A lot of time it's good to see the neurologist, make sure there's nothing internal going on that is producing those dizziness and lightheadedness.
Okay, so we have a dietitian.
We have dietitian. We have Courtney in Boynton seeing her patients.
And we have Carol in Fort Lauderdale.
And we have Carol in Fort Lauderdale seeing patients. So we have dietitian in both centers today.
Fantastic.
And we have the dentist seeing patients and the hygienist. So we're going to be doing from cleaning all the way to implants. All of that get done at the center.
Top to the bottom, right?
Top to bottom. Then you go to Stonewater Med Spa and go to the beautification. Then you have that smile and you have that look.
That's you.
Smile with the look. You have to put them together.
Dr. Mencia. Let me give some phone numbers. Just go down to the AGI Medical and Dental Center in Fort Lauderdale, and that's at 1608
East Commercial
Boulevard in Fort Lauderdale, and the phone number there is 954-489-1345.
That is 954-489-1345.
Okay, and let's talk about Boynton Beach. It's over there in Hagen Ranch Road, Boynton Beach, and the phone number there is 561-270-6494. And then home visits, we don't want to forget that. Home visits
are available for those patients that are homebound. And, some of my patients that had been with me for a long time and over the year, then they decompensate and end up being homebound, either short, because we try to get them back out there. We have some of those homebound patients that they go, Dr. Mencia, I want to come to the center at least every 3 months. I want to come here and see you here at the center, which is great. So we know taxing is very difficult for the patient and the family, but why not? So We do everything we can to provide excellent service at home. Of course, it's not the same like being in a hospital or coming to the office, but we try our very best to make sure that you are treated with dignity and that we do all of the things that are possible while the patient is at home.
And I want to add something to it. A lot of people wind up in rehab centers unnecessarily.
Exactly.
And
yes.
they could be at home.
They could be at home.
You send in physical therapists and occupational, don't you?
Right. We send the physical therapy, the occupational therapist. We send the speech therapist. All of those services are available. But talking about the med spa and constipation, when you go to your massage therapy, not when you go to those massage that you pay, whatever, $10 for an hour. When you go to a true massage therapist, Stonewater, if you tell the person giving you the treatment, your operator, that you do suffer from constipation, and this is a massage, if you learn from them, this is a massage that you can do at home. And I always teach my patient because I don't want them to take medication if they don't have to. So what you do is, we have the belly button over here, and then we go to the right, and you have the beginning of the large intestine that we saw the picture of before. And while you are sitting on the toilet or while you are laying down in bed before you get out of bed, what you do is you take your hand, and with your two hands, you start pressing on the large intestine, you start pressing in, and then you start like a worm, pushing a worm, if you just
great.
Keep pushing up until your fingertip come in touch with your rib on the right side.
Yeah.
That means you reach the top of the large intestine up here.
Right.
Now we have to go this way. Now we have to go here. Now if you see that there's a little curvature coming this way, the large intestine, when they go across, it's not straight. It comes with a curve, a downward curve.
I like better when you do it in your body.
So when we go here, let me take off my shirt. So when we go...
Oh, God, this Facebook Live is just going to be the ruination of us.
Facebook is going to knock us out. Say, no, it's people getting triple X.
Right.
So then you go from the ribs, you go down a little bit toward your belly button, but not all the way to the belly button, and then come back up to the other rib. And now, once you get to that other rib, now you go downward, and you go downward till you get to the pelvic again. Once you get to the pelvic, this is what we call the sigmoid. The sigmoid. It's called sigmoid because it looks like an S. It has an S shape. So once you go down here, then you come to the top of your belly button. Mm-hmm. So you come from here, you make a little S, so you come to the top of your belly button, and you go straight down to the bottom. Then you do it again.
What are you doing? What is it doing?
The large intestine, there are two things that will stimulate, two natural things that will stimulate your large intestine. One is anything hot. So you take hot water and you drink it, that will stimulate your large intestine. And those of you that have been through med school, remember when we used to take the little frog, and we used to take the frog and we used to throw hot water, and the intestine would start moving quick. And if we put ice water, it stopped moving. It will just stop the movement. So ice will slow it down. Heat will pick up the movement of the intestine. And then touching, manipulation. So when you touch your intestine, sometimes when you walk, it helps you with the bowel movement because your muscle and your intestine are touching each other. They're basically making, that will help your bowel movement. So by doing that massage, you do this massage a few times, and you do it every day, and follow a high fiber diet, and that will help you with your constipation and will prevent all of the complications that we spoke about about constipation.
So, Dr. Mencia, you've done a great job today. This is quite a demonstration. I can't get over it. So, happy Valentine's Day. I just got something from Dr.
Thank you for
Mencia
my Valentine gift.
From the Brillante Jewelers. I want to help them, so that was great. Thank you very much for being here. This was quite a demonstration. We'll have to do this more.
We'll have to do it more often. And don't forget to do your exercises.
Yeah, I do the exercise too. I love this.
Yeah.
Okay, well, we'll see you next week. Thanks for listening to The Wonderful World of Wellness with Dr. Andy Mencia. Be sure to tune in each Saturday morning from 7 to 7:30 right here on WSBR 740 AM.